WOR New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. We're taking your calls. We're live in the WOR studios. We have Noah in the studio with Ed. You can call them, and they'll put the call right through. They're at 800-321-0710, 800-321-0710. People have asked me to say that a few times because I think I don't say it, but I think I do say it. So please give us a call if you wish. I want to talk about another interesting case that I saw on Friday. An 82-year-old man, is a black man, widowed, and he had been in another hospital. She'd been in a hospital. We're not a hospital. We're a freestanding cancer center where you go to your own house and you go to your own bed and your own kitchen and your own life. We don't want to replace all that. We want to treat you and get you home. He was in another hospital in April, so it's now April, May, June, almost July on Tuesday. And he had pain. He had a CAT scan and bone scan. They found a lesion in his leg. They didn't tell him anything. They didn't give him any options. He lost 50 pounds in that period of time. He has a poor appetite. His clothes look like they were for another man. He had lost so much weight. He looked cachectic. Cachectic is when the cancer starts eating your tissues because it's growing at your expense. We found he had a rock hard prostate. We ordered blood tests for the prostate. We ordered a staging for the body, all in one day. He had everything done in one day, like I reported to you. We had everything done in one day. So it appears that he has a prostate cancer with metastatic lesions in the bone causing pain. The prostate cancer is so big it's blocking up the kidneys, so he's in hydronephrosis, both sides, so the kidneys aren't working. Can you imagine that he was sent home in April from a hospital with no care and no follow-up? It's hard to believe. It's really hard to believe. So we did all this within one day. We're going to get the kidneys unblocked. We're going to get the pain taken care of. We're going to get treatment going to reverse the cancer, and hopefully he'll put that weight back on and get rid of the pain and get the cancer treated and get his kidneys protected, because if the kidneys are blocked, that blockage can actually damage or destroy the kidneys, which is terrible. All of this is terrible. And to think that he was in a hospital and nothing was done for him is just amazing. So if it sounds familiar and you need care, you don't need to sit and suffer. You don't need to wonder. You're welcome, like the patients I said, to give us a call, and we will take action to help reverse what we need to do. There's an article this week by Catherine Doyle in Reuters, and its main premise is that women with breast cancer are not getting needle biopsies like they should. That many women, unfortunately, are seeing surgeons who, instead of doing the easiest, cheapest, fastest biopsy, which is just sticking a needle into the cancer, are taking the women to the operating room and opening up the breast and making a big incision and taking out a piece of the lesion for analysis. Remember, the first step is, after a suspicious lump is found, is one needs to confirm the diagnosis. So we know that even with abnormal mammograms, 80% of those abnormalities are not cancer, they're benign. And who wants to have a incision in their breast? Who wants to have anesthesia? And who wants to have a distortion of the breast? If they take out tissue, then the breast will be smaller, so there'll be distortion. So who wants that? I don't think anyone wants that. So this article was written by Catherine Doyle, and quoting a doctor, Dr. Benjamin Smith in Texas, has said that needle biopsy is the standard of care. having a 3 or 4 centimeter incision in the breast is going to hurt a lot more and take longer to heal than just putting in a needle, he said. The surgical approach is sometimes called an open biopsy because it requires an incision to access the lump. It's also known as an excisional biopsy. Well, obviously, excisional biopsies cost more than a needle. There's more convalescence, there's more downtime, there's hospital time, there's anesthesia time. Who the heck wants that? And they analyzed in this paper how many women had needle biopsies versus excisional biopsies, and they found that a great number, thousands, had procedures that probably weren't necessary. And that's what this program is about, to try to direct you. And we know that there's 250,000 women with breast cancer, which means there's probably 1.5 million women getting breast biopsies a year. So we're talking about a huge number, and if we can save unnecessary surgeries, save procedures, save distortion of your breast, we think that's what you want. That's what I'd want to know, and I'd want to have a doctor who speaks for me, who's my advocate, who wants to do less surgery rather than more. This paper was in the Journal of Clinical Oncology just this month, June 2014. There's radiologists. We work with a group. We had a woman come in this week on Thursday. She had a lump in the breast. She was proposed by a surgeon to have biopsies of her breast, radiation of her breast, chemo, and then hormonal therapy for years. And she ran away. Actually, it took her 6 months to come to us. Because she was so traumatized by the surgeon. I saw her. She was concerned about biopsy. She was concerned about the lump which she felt herself. I saw her at 2 o'clock on Thursday. By 3:30 on Thursday, she was seeing a great radiologist. He put a little needle in the lump. There was no trauma, no pain, no suffering. He did it, as he said, 1, 2, 3. It was in and out, and now great pathologist is going to analyze it. I called this woman on Friday to see how she was doing. She was doing great. She was eager to get the answer, of course, and we're eager, too, to give her the correct answer, the appropriate answer, and then, if necessary, treatment options that will give her the best chance of living a normal life, living a cosmetically intact life with the breast intact as much as possible. So, do we follow our own advice? Yeah, we do. Whether it's good, bad, or otherwise, we do. And we hope you find reason to think about our advice as well. If you have questions, give us a call. I want to talk about a woman at this time, a 71-year-old woman, widowed. She had 2 sons, brought her, and they called me a few times and said, just tell me, what do you do? What do you do? And I said, well, just like I'll tell you, it's really best to come in and sit down and go over the details of the case. And this woman, it was very interesting. She had an endometrial cancer in 2011. She had bleeding, vaginal bleeding back then. She had standard radiation followed by surgery, a hysterectomy in November 2012. And then within a short period of time, the cancer came back. And she's had chemo for more than a year and a half. Well, as you probably know, chemo does not work very well for endometrial cancer, but that was the only option she was given. They biopsied the labia, which was involved with cancer, as well as the urethra. The urethra is a urine tube going to the outside. So she had advanced cancer. Again, we got her staged the same day, so she had all the answers same day. Last week she got 3 units of blood because she lost so much blood. A couple of weeks ago, she lost enough to be transfused 2 units of blood. So we've arranged for her to get options to stop the bleeding, hopefully to get the cancer under control. She had a PET scan which showed metastasis to mediastinal and adrenal areas. So those are certainly treatable with radiosurgery, which is a non-invasive technology that allows us to treat most any cancer with a high degree of control, non-invasively, outpatient. So she's got the images in her hand, she's got the reports, and she's starting first treatment tomorrow. What's happening to all those new health cares of the government? Well, there's just an article this week in Wall Street Journal that said that people that enrolled in the new plans are showing higher rates of serious health conditions than other insurance customers. Now, the health care marketplace, you probably heard about it, or you've even gone there, or you've even bought insurance there. The health care marketplace that you've heard so much about in the last year, there's a 27% chance of having significant health care problems among people that are going to that site. What kind of problems? Well, diabetes, psychiatric problems, asthma, heart conditions, or cancer. This 27% is much higher than the rate of 16%, which was last year's individual market rate. And in people with long-term insurance, like people who have insurance through their employers, the risk of having serious medical problems is 12%. So obviously, with a 27% or double the rate of other groups of people, you can imagine why the rates are going up. And the insurance companies obviously are charging people more because they're taking high-risk people. The Obama administration wanted a lot of young people who are generally healthy to roll in also and pay their premiums to help subsidize these sick people. But you can imagine if 27% of people have serious health care problems, there's not enough young people and healthy people to subsidize the sicker people. And that's always been a concern. It's a concern of taking care of sick people. It's a concern to everyone in the medical profession. Is Obamacare going to solve these issues? It doesn't look like it because they're not getting the enrollment of healthy people to subsidize the very sick people who are enrolling in Obamacare at health.gov. And we have a patient from Miami on the phone. Good evening, Miami.
Hello.
Good evening.
Good evening. How are you today?
Fine, thank you
so much. I have a patient which name is Mildred, and she has been diagnosed with a bladder cancer, and we are interested to go and visit the doctor over there. I would like that you talk about, because she's very emotional right now, and she's concerned and very worried about what's going on in her.
Well, it's a good question, and we actually take care of a lot of people with bladder cancer. Unfortunately, a lot of patients with bladder cancer don't know there's non-invasive options. You don't have to necessarily get the bladder removed. You don't have to have that radical surgery. There are treatment options, and proven by data over decades that you can, for most patients, you can keep the bladder and have a high degree of control and a much higher quality of life than with radical surgery. Obviously, we would have to sit down, get a history, examine the patient, and know if the cancer's traveled or not, and if so, where.
Oh, okay. Thank you. I would like to keep in touch with yours to make an appointment for her, because she's planning to go and visit you at the clinic.
Okay, well, you're welcome to do that. Just call us the same number you called. Actually, this number, 212-246-4237, 212-246-4237.
Oh, okay. The other question is, she has been treated with a Mount Sinai Hospital doctor, and she has been during the last 8 weeks on the treatment, and they want to make a biopsy right now. She has already waiting, and that's the reason we call doctor, because she's very interested to get answers about what's going on. You know, they say they need to do another biopsy, and she has been waiting, I think, in the doctor. The condition started in November. Yeah, the condition started in November, and they say right now it's going to be more aggressive, and they can do too much, and that's the reason we want that you take care about her.
Okay, just give me a call tomorrow, and if you need something better or faster, we can arrange it better, faster for you to see a urologist and get a biopsy quickly. So just give us a call at 212-246-4237. We have staff that speaks Spanish, Italian, French, Farsi, Russian. So we have whatever makes her comfortable. We will help make her comfortable in her language and do the right thing.
Yeah, let me ask you something else. You have only Humana and H&O, and that's what we are interested to call you